Good afternoon, everyone. This is Dr. Eric Toring with the American College of Veterinary Preventive Medicine. I want to welcome you all to our webinar today. The ACVPM is sponsoring this webinar to just provide information about federal and state veterinary career paths. We've got an excellent panel of speakers today. I want to provide a couple administrative announcements. First of all, we're going to leave all the attendees muted for the time being, just so that the panelists can get through their individual presentations. We will take question and answers after all the panelists have had a chance to present. If you can hover somewhere on your screen, you will find the raise your hand feature. If you have a question, when that time comes, you can raise your hand. I will call on speakers. If you do not want to speak, you can also type your question into the question and answer feature of the Zoom platform. Before we get started, we do have a little bit of a poll that I would like to send out. I'm going to do that right now. I'm going to launch it, basically asking you what organization you may or may not be affiliated with. So with that, I'm going to turn the webinar over to Dr. Kristen Voll. She is the chairperson of our Partners Ad Hoc Committee for the ACVPM. So with that, Dr. Voll.
Okay, thanks. Sorry about that. It took me a second to unmute myself. I just want to say a quick thanks to all of our panelists that are joining us here today. We have Dr. Stacy Greeby from the CDC, Dr. Stacy Schwalmann from the Minnesota Board of Animal Health, Dr. Laura Rosfeld from the Arkansas Department of Health, Dr. Susan Rollo from Texas Animal Health Commission, Dr. Stephanie Wire with USDA APHIS, and Major Morgan Mander, who's with U.S. Army Veterinary Corps. So we have a fantastic panel to share their various experiences with anyone who maybe is looking for career transition, just starting out. Really excited to hear what they have to say. So thank you all for joining us, and I hope everyone enjoys the panel.
Okay, with that, we will go ahead with Dr. Stacy Greeby from the CDC.
My name is Dr. Stacy Greeby. I currently work at the CDC Nigeria country office. Although at the moment I am sitting in a parking lot in Atlanta after waiting for a COVID test. I've been at CDC for a little over 20 years, first as a fellow and then as an epidemiologist. I've worked in multiple centers at CDC, primarily with HIV, domestic and international, as well as immunization. But for immunization, it has been primarily domestic. I've also had the pleasure of working on most of the pandemics that have been, most of the recent pandemics. H1N1 response, I was stationed at CDC Gap, India. For the Ebola response, I was actually working on the vaccine trial, and I was the deputy team lead in at the trial startup posted to Freetown, Sierra Leone. And for Zika, I was here in Atlanta, part of the response supporting deployers, working on clearing scientific papers. Right now, I am working on COVID, but supporting the COVID response in Nigeria. I'm home for a little bit of R&R right now after going through from the previous 14 months or so. But that's basically my background. I graduated from University of Illinois. I practiced small animal medicine for about 10 years. I went back, got my master's in public health, and then joined CDC as an epidemiologist. My unifying background to everything probably is working on surveys and response for surveys in one way or another, and very much pulling on my veterinary background. So what's on the slide, how the questions were posed was like, I've been for 2.5 years in Nigeria, but before that it was 8 years in immunization, and then another, 10 years in HIV, and before that, another couple years in immunization. So what I serve as is I also serve as a science officer at CDC. We are the people who ensure human subjects protection. It's a very critical function at CDC. And we also ensure the scientific integrity of CDC. So there's an awful lot of reading protocols, reviewing papers, as well as, when I turned 50, I learned how to write my first tweet. So, making sure that what is out from CDC is scientifically accurate and in line with the policy of CDC. So those are the main things that my background. And I will say there's some dedicated people at CDC working. We tend to cross, some of us are veterinary officers, some of us are epidemiologists, some of us are public health scientists. It varies what role we'll fit in, but we do cross over into a lot of things and support a lot of varied activities. And I can usually find a veterinarian in almost every single center at CDC. So that is the basics that are on the slide. And I think we have other panelists that need to fill in next.
Okay, we thank you, Dr. Greeby. We will go on to Dr. Stacy Schwalmann.
Hi, my name is Stacy, as Dr. Toring said. Thank you. I'm with the Minnesota Board of Animal Health, and the Board of Animal Health is the state animal health officials of the state of Minnesota. So we house the agency that's responsible for both mandatory and voluntary disease control programs for the state of Minnesota. And we deal with all domestic animals, captive animals that are wild as well. That would include the farm servant program, also fall under our purview. So all domestic or captive wildlife can fall under our programs. And I started with the board actually directly out of veterinary school, but with some struggles of trying to find a job in private practice on the side, I ended up actually leaving the board for a year. And then I came back. So in total, I've been with the board for 12 years with a 2-year respite, which I spent in private practice to get a bit of an idea of what that would be like. And I basically already mentioned what the purpose of the board is. And we do a lot of different kinds of activities, from emergency response and preparedness to surveillance, control, and eradication. And you may have heard about our agency with the worst foreign animal disease outbreak in the history of the country, which was back in 2015, which Minnesota unfortunately stood out in quite a bit after losing 9 million turkeys. So I, along with being the director of cattle health programs, animal disease traceability, biologics, and the state Scrapie designated surveillance epidemiologist, I also had the responsibility of working with continuity of business permitting during the High Path AI outbreak in 2015. And there are basically 4 different opportunities with our animal health agency, which I can't say is standard across all state animal health agencies, but to at least give you an idea of the types of positions that may exist in other states. Here in Minnesota, we'll have the district veterinarian positions, which are the veterinarians who are housed out of their home offices, and they're scattered throughout the state of Minnesota, and they're doing the boots on the ground work, the work that program managers that are in the office send out and administer the program. So they're doing the foreign animal disease investigations, they're doing a lot of inspections, animal movement investigations, they're doing all of the caudal fold responder follow-up testing that the private practitioners are doing, that sort of work. Then we have the senior veterinarians, which is an example of the role I'm in. We are program directors, so we're typically based out of our St. Paul office. There is one senior veterinarian as well that's based out of the Wilmer Poultry Testing Lab, which is in the center of Minnesota. And we administer all of the different disease control programs for the board. So as I mentioned, I do all of our cattle programs, traceability, Scrapie, and biologics. And then there's also assistant and executive directors. So our assistant directors will be acting when our state veterinarian is otherwise occupied, and they do also help with some program management. And then our director is also our state veterinarian. And so she basically has oversight over the whole kit and caboodle of the Board of Animal Health and keeping things running. And again, she's involved with higher level management, as you can imagine, of all the programs and the direction of the agency. And she works very closely with the 5-member citizen board of animal health that helps also to direct our work. And those are governor appointed individuals. So that's basically the 4 different opportunities that are available at our agency. And there's likely somewhat similar roles in some other animal health offices. Though I have to say that we are pretty unique in the state of Minnesota as having as large of an agency as we have to perform this work. So I don't know that all animal health offices are quite as well staffed as ours is. When it comes to advice for getting into this field, one of the things that I have found to be true is the importance of networking. That was drilled into me very early on during my MPH DVM by Dr. Will Houston, who some of you may know. A lot of times who you know is really, really a vital thing when it comes to opportunities. And use that network to get involved when opportunities do arise to make sure that you can get your name out there and open up more doors in the future. And while private practice is not required to be in the position that I'm in or to work with an animal health agency, it is often looked upon quite favorably depending on the role you're looking to fill, as there's a lot of important skills that are learned in private practice that may not be specifically related to medicine and surgery, but are nonetheless very important in this kind of a non-traditional field. And why? This was just a slide I just wanted to add because I think that a lot of you probably know that in general, these sorts of positions are considered to be a lot easier for lifestyle choices with family and things like that. And I will definitely admit that I can't not mention the importance of the lifestyle option, which, 95% of the time, I would say that my schedule is fairly predictable. It's that other 5% that isn't, which is quite different from private practice, probably quite exactly the opposite from private practice. But, in high path AI, as an example, I worked about 16-hour days, 7 days a week for, I don't even know how long. I don't honestly remember. April of 2015, that entire month is completely lost to me. I don't really know what happened. So there are definitely stressful and strenuous times, and there's always a lot of work to be done. But the big benefit of these sorts of roles is you can really affect change. So you can get involved throughout the state and as well on national working groups, and you can really affect change and see things happen both statewide and nationally when you're involved in these sorts of organizations. So that's where I find a lot of job satisfaction. And that's why I have decided to go to more of a non-traditional role in veterinary medicine, because I've really been able to enjoy those sorts of leadership opportunities and just being able to collaborate with colleagues across the country to be able to get things done. And some of the pictures, I admit that I spend most of the time in the office. So that's what that last slide was supposed to show. I do spend most of the time in front of a computer screen. There is no doubt, but I also am lucky to be able to have the opportunity to get out in the field, TB testing when, back in previous times where Minnesota had some TB troubles and other opportunities as well, where we can get out and have some sunlight and some time on the road, just like our field veterinarians. So there's always opportunities to get out and about, but in complete transparency, the majority of the time is spent more on the administrative side with computers, but I don't actually mind that. So. And that's it. And I have my email up there, and I'm happy to chat with anybody who's interested in this sort of position who may have any questions.
Thank you very much. We will move on to our next panelist, Dr. Laura Rosfeld.
So I am Laura Rosfeld. I'm the State Public Health Veterinarian for the Arkansas Department of Health. And, that role gets confused sometimes with the role of state veterinarian, so which would be the Department of Ag or what Stacy was just describing as her role. So our role is at the State Public Health Department is more with zoonotic diseases, and we deal more with humans and than animals. But sometimes we do get to deal with the animals. Certainly during COVID, I've had a lot more interaction with some animal practice issues than before. So I guess I'll start at the bottom instead and kind of work my way up on how I got into this role. So I graduated in 2000 from Oklahoma State University, and I tried my hand at mixed animal practice. It was a very rural practice. I was on call all the time. I was out pulling calves every night, I felt like, and chasing horses and doing all that good rodeo fun in Oklahoma. I quickly, what's the word? The grandeur of that sort of dream quickly faded after spending, a year doing that. I ended up having my first son while I was doing that, and decided that, maybe this isn't quite what it was cracked up to be, what I felt like I had gone to veterinary school for. So in the meantime, I had a relative who was in the Army he was actually teaching history at West Point. And this was right after 9/11. And he convinced, me and my husband, who was an ag teacher at the time, to travel and see the world. And so it just ended up as a good opportunity to direct commission into the active Army. So I did that for a period of about 14 years, where I was both active duty, and then I did the reserves. And then while I was a reservist, I was also an Army civilian at an Air Force base where I had been active duty, and then decided to go back active duty for the the education benefits. And so I kind of just jumped in and jumped out, and have a lot of experience in all components there. And while I was in as active duty, my long-term health path that I chose was the Epidemic Intelligence Service with the CDC. So I was actually still in the Army, but I was assigned to the CDC for their 2-year fellowship. And my field duty happened to be at Arkansas Department of Health. During that time, I also was in Sierra Leone. I know, who was it, Susan, or I forget who it was at the beginning, that mentioned Freetown. I was actually in Kenema during the Ebola outbreak for my field deployment with the Epidemic Intelligence Service. And so that was definitely my first experience and foray into a huge worldwide outbreak response, even though most of those cases were confined to West Africa at the time. There was the threat and the feeling worldwide that this, or at least in the United States, I know that this could become a bigger issue. And so, I feel like that prepared me for the current environment that we're in with coronavirus. And so after my CDC EIS duty, I ended up back, I had to go back to the Army, and ended up working for another 3 years as an instructor at a FIGB site, which is the first year graduate vet education program. So I was instructing new captains in the Army on their roles in the Army, the public health side of things with food safety and public health and all of that kind of stuff. And at the time, I was having some medical issues. I ended up with a medical discharge from there, so a medical retirement. And at the same time, the state public health veterinarian from Arkansas was retiring. And so, somebody else just mentioned networking as well. And I feel like that was an important player in how I am in my current position, because they had worked with me for 2 years and had reached out to me and just asked if I was interested, and the timing was just right. And I look back on it now because I was just cleaning out, I'm kind of a hoarder, so I've moved my books and notes from vet school for the last 20 years all across the world, apparently. And I actually was just going through them this weekend and throwing things out. And I found a lecture from the state public health veterinarian in Oklahoma from 20 years ago, and found her notes. And I thought, this is interesting, because she was still working there a couple of years ago when I took this position. And I thought, it's come full circle, because when I was in vet school, I thought, that'd be a really interesting position to have. but I didn't quite know how to get there at the time. And I felt like I was spending all this time on clinical practice that I needed to go into clinical practice in, MPHs and public health and all these different alternative careers. They weren't really presented to me at the time when I was in vet school. And I feel like now that, a lot of people are getting more into seeing that there are alternative careers that can provide a work-life balance that was also just mentioned, because I feel like, my role here is a much better lifestyle balance than I had when I was in a rural private mixed animal practice at the time. It just worked out better for me. I know that some people just love it, but to be honest, this is like the capstone of my career. I feel like it is put everything together where I absolutely love it. Every day is different. So, a public health department is a little bit different than the Board of Animal Health, but we certainly work together. And I thought that was an important point about how you can have an effect on, things at, the state and national level. And so, I work with my state vet. I work with the state wildlife vet. Our Game and Fish Commission actually has a veterinarian. I work with the University Extension veterinarian here. And, we all work together, but we all have our different sort of sectors that we are focused on. And so with the Department of Health, our focus is on surveillance and outbreak response and education. We at Arkansas, we are a centralized state health department, which means that we have one main health department in Little Rock, and all of the counties, the 75 counties, report to us. That's a little bit different than some states. They'll call it a home rule or a mixed, maybe like Oklahoma's got kind of a mixed setup where most of the state reports to the state centralized level, but the city of Oklahoma City or Oklahoma County and Tulsa, I'm not sure if it's the cities or the counties, but they have their own sort of reporting mechanism that they, are kind of separate. But we deal with the outbreaks. I deal with zoonotic disease outbreaks. I'm looking at surveillance for things like tick-borne disease. We identify, new viruses such as Heartland and Bourbon virus. We look at the impact of tularemia, because Arkansas is a bit, one of the biggest burdens of tularemia, which is tick-borne here, mostly for our state. West Nile virus, any of the arbovirals, we are conducting surveillance on. I've got a brucellosis case I'm looking at right now, a B. suis, that is potentially connected to feral hog hunting, which is a problem in our state. And so, and then of course, probably 95% of my time is taken up with bite consults for rabies risks. And so I monitor the rabies epidemiology throughout the state, and I get calls from the general public. I get calls from physicians, nurses, nurse practitioners, veterinarians on how to handle rabies risk exposures. And that is almost a constant daily basis. And I am on call for that, but I love it. It's way better than being on call to get called out to pull a calf at 4 a.m. in the 20-degree weather and snow. So I'll take that any day over the other. I would say advice for getting into this field is that certainly an MPH is helpful, but I do not have one. That was one of the degrees I just skipped. I kind of got my vet med degree and then went on into the Army, and then took the ACVPM board exam without that. And I keep saying I'm going to go back and get, some other degree. I looked at a DRPH. I looked at a PhD in epidemiology, but it just the timing just has never worked out. And so, but it hasn't seemed to have hurt me so far. I've kind of been able to meander my way through, I guess. Certainly ACVPM is helpful. Being boarded in preventive medicine, whether that's, going through a master's degree and then getting it, or doing it the route I did. Broad array of experience. Networking was one that I wanted to highlight as well, because it certainly seems to be a way to get into these positions that are few and far between sometimes. And so, really getting your name out there and letting people know who you are and what you're interested in, and maybe shadowing and just learning about the different types of positions, so that you can focus in the direction that you want to, because there's so many different opportunities I was not aware of previously. I think the fellowships, like the EIS fellowship I did, other CDC fellowships are helpful. Military service, public health service was something that I looked into as well. After I was already in the Army and gone to EIS, I thought, wow, this public health service is something that I could have done as well and really enjoyed myself. But, I think it took those years of doing everything else to get to this point. Of knowing that this is really where I love, because I'm just a jack of all trades. I kind of like a little bit of everything. And then this is about me, and it doesn't show through. What it says is under those pictures is it said mom, wife, daughter, vet squared, and public health champ. And those are kind of my titles I call myself. So, I was just one of those people that always wanted to be a mom. And I know, there's a lot of people aren't that way, but I stressed about going to veterinary school because I thought, well, how am I going to have this family and this life? And it's worked out wonderfully. My kids in the Army have been all over the world, and they've become really resilient and adaptable children. And I have one at West Point now as a cadet in his second year. So we're super proud of him. And then the 16-year-old still at home, but I'm also, I call it vet squared, being a veterinarian and a veteran. But I'm certainly a public health champ. And so, there's some pictures in there from my time in Sierra Leone for Ebola, working, with different cultural and behavioral issues that, expand your mind on what public health can be, because it's, you can spout science and data, as we've seen here in the United States with COVID. You can spout science and data all day until you're blue in the face, and it may not make any change until you start to dig deep into the psyche of people and working on different cultural ways to address those issues. And then I like to have a work-life balance. So of course there's a picture of the lake and, my dog and relaxing. And next slide, please. And there's my contact information. I have to put a plug in for the National Association of State Public Health Vets, because I am president of that organization until June. And so you can become a member, an associate member. If you work for the state or local government in public health, you can become an active member. But we do have an associate membership for a small amount of money that you can join, and then you can have access to our resources. We have a listserv where we throw out all these weird things that happen, and people can chime in on how they've handled certain situations. And I'm the lead of our One Health group here in Arkansas. And so if anybody's local, they can certainly join me there. But I encourage you to look for a One Health group in your state, because lots of states are setting those up. And they'll be comprised of folks like I was describing from the state, ag department and the health department and the wildlife and the university. So I encourage you to be able to network with those people through that avenue as well. And I thank you very much.
Okay, thank you, Dr. Rothfeld. We will move on now to Dr. Susan Rollo.
Okay, hi, I'm Susan Rollo. I'm the state epidemiologist for the Texas Animal Health Commission. So similar to Dr. Schwalmann, I'm not sure if I pronounced that correctly, but I am with the state animal health organization in Texas. And I began with this agency in 2014 as a field epidemiologist, and then I was promoted to the state position in 2016. And I've been in this position for 5 years. I started out, graduated from vet school in 1993. And at that time, I was looking for some kind of an alternate route of veterinary medicine besides practice. And I looked into USDA and a few other routes. I also did an internship at CDC, so I was lucky to get that opportunity. And I was actually on the Jack in the Box outbreak, if y'all remember that, for E. coli. And I didn't find anything, so I went into practice for a few years. And then after 9/11, there was an expansion in the state for epidemiology positions. And living in Southeast Texas, where I moved to with my new husband, I became the epidemiologist for a local health department. And that was, again, an initiative after 9/11. From there, I started getting interested in expanding my education. So I went back to Texas A&M to work on a PhD in epidemiology. And at that time, I was the director over the master's program for people like ourselves who are looking to get a master's of public health. And then I was also a research assistant while I was completing my PhD. From there, I went to the state health department as a zoonosis control veterinarian. So similar to Dr. Rosfeld, I was in the Houston area and covered 16 counties in that area in that position with rabies and West Nile and those kinds of things. And then I just always was interested in Texas Animal Health Commission. A position opened up, and so I decided to take a risk and switch over to the agricultural side of things. And that's when I switched over to the current agency. And you can switch slides. So again, we're the state animal health agency for Texas. A lot of things that I do. First of all, we are an emergency agency, so we have to be willing to go work areas for extended periods of time. And especially as a field epidemiologist, I covered all of East Texas, all the way from Houston up to Texarkana. So I did quite a bit of traveling at that time. And I was interested in this agency earlier on, but with kids, it makes it hard to be able to travel. And especially with my husband who works 24-hour shifts. So I wasn't even able to work in this agency until my kids were in high school and college. So just another point to make about family. And also with Texas, we're a big state. We have a lot of disease issues. We have the cattle fever tick problem along the border between Texas and Mexico. And so I spent quite a bit of time down there working as the epidemiologist for tick response during the first couple of years of my time in this agency. Also, we had a lot of several big dairies up in the Panhandle with TB. So I got a lot of field experience, TB testing and working in the dairies for those outbreaks. And so the other big disease that I spend my time on is chronic wasting disease in captive deer and elk and so forth. And so I spend quite a bit of time on those diseases. But in Texas, we don't have specialties in like we don't just cover like each person covers all diseases. We have regional areas, and the regional directors, they deal with all the diseases in their area. And so as a state epidemiologist, I do have a lot of diseases I'm working on every single day, almost regularly. I switch from TB to chronic wasting disease to anthrax, et cetera, et cetera. So that makes it challenging in my position because you can't really be a specialist in each one. You have to be able to switch gears at a moment's notice. Other things I do is I collaborate with other agencies such as the health department on SARS in animals. I also collaborate a lot with the lab. Whenever they have a disease or so forth, they will contact me and I'll contact the regional directors and let them know that they need to respond to a certain disease. And I also work a lot with Texas Parks and Wildlife on chronic wasting disease, and I attend a lot of their meetings, and so we do a lot of collaborative work. So the point is that one of the big things in this position is being able to collaborate with other agencies as well as industry groups. And so that's a very important thing for us. I also work on a lot of policy, do some education and messaging with our communications group. I spend a lot of time writing risk assessments and herd plans, and those can be very complicated, often 17 pages plus on just one herd plan based on the complicating factors that this herd might have. You can't write a generic plan for each situation, so I do a lot of that. And then I do a lot of data analysis and data presentations. And so that's kind of an overview of what I do. As far as opportunities, yes, there are. We actually have a position open in the Laredo area or along the border for a field veterinarian. And my suggestion would be to just get your foot in the door. It may not be your ultimate goal to be a field veterinarian, but if you start out in that area, other positions often open up and you're able to move up into other positions. And similar to what others had said, we have field veterinarians, field epidemiologists, regional directors, the assistant state vet, and our executive director. So those are the positions we have in our agency. Also, there's obviously VMO positions in the state, and we work very closely with our federal partners, not only the epidemiologists, but in Austin, but the epidemiologists and veterinarians along the border and the cattle fever tick eradication program. We all work as very good partners here in Texas. And again, as far as, professional risk, I would just suggest diving in. I didn't know a lot about cattle coming into this position, but one of the things that people say about me is I'm willing to listen to the people who know and learn from them. And so that's how I've been successful in this position, is being open-minded, getting out there, learning things out in the field, bringing that back into the office. And, it was a risk for me to do this. It's less, it's less comfortable being over here and behind a cow, injecting them with tuberculin than it is, in an office somewhere. But that's the risk I took, and I am not bored at all. I have every single day. I'm very busy with a lot of different things, so it's been worthwhile. And with that, my contact information is listed there, and I'd be happy to talk to anybody that was interested and or had other questions. Thank you.
Thank you very much. We will move on. We've got two more panelists. We'll move on with Dr. Stephanie Wire.
Hi there, and good afternoon. One thing I've noticed with everyone that has talked so far, that really brought up networking is a big thing. And then I think a lot of us are kind of jack of all trades in this profession. So there is not much I have not done in veterinary medicine. And so the USDA, which the agency that I'm currently working for, just has a ton of opportunities. So I'm the epidemiology officer for the state of Illinois. I started that position almost a year ago now. So in end of April will be my 1-year anniversary. How I got into this was my background is in mixed animal practice. So I'm a 2007 graduate of the University of Illinois. And I pretty much straight went into mixed animal practice. I enjoyed it. I did large and small. I can definitely emphasize with the being on call and pulling calves and putting prolapsed uteruses back into cows in like 8-degree weather. So it's and long hours for sure. But it's one thing to do that when you're young and single. It's different once you have a child, and you have other obligations as well. So I've been also a member of the Army Reserve since 2009. And we have another Army vet talk, so I'm not going to get too much into this. But basically, there's several different missions, and one of those missions is the food safety mission, and which is a part of definitely of One Health. And the Army always has pushed like that preventive medicine aspect, and so. Once I made up my mind to actually do the board certification, I did that in 2017. At some point, I wanted to actually kind of work in that field too, because You get more exposure, especially the military a lot of times offers you a lot of different areas to work in. And I was very fortunate to be able to go on a deployment in 2019, 2020 to the Horn of Africa. And just to have this whole herd, One Health aspect of it was really kind of eye-opening. And I knew that after that, I wanted to do something that's more than just the individual animal. So I applied when I just happened to, I came back from one mission and it just happened to be an epi position open in my home state. And I applied for it and somehow I ended up getting it. And so that's what I've done ever since. I would say there is no such thing as an average day. We have so many different programs. So what I do, amongst other things, is monitor disease outbreak, foreign animal disease investigations. The state of Illinois has a little bit of a special arrangement with our state partners, which we're really good. We work really well with, but we actually only have one single field veterinarian in the state of Illinois. So a lot of times our VMOs, the USDA field veterinarians, kind of fill that role. And, there's also only so many to go around. So I'm actually pretty lucky that I get to go in the field quite a bit for the investigations. I get to swab vesicles and I get to necropsy rabbits when we were worried about rabbit hemorrhagic disease and looking at some horses with oral lesions. So, I mean, it's not just a desk job. It's pretty much whatever you make it. There's a ton of opportunity for just continuing education to broaden your horizon. But yeah, so disease surveillance is definitely the number one thing. So previously to that, also, I guess I forgot to mention, I was working as a NAV, Army VMO. So basically that's a civilian veterinarian working for the Army in a veterinary treatment facility, basically taking care of the small animals that belong to the cats and dogs for the most part, to the service members and their families. So that was really rewarding too. And I got to interact with the OIC, the veterinarians there, and the technicians and food inspectors. So I really enjoyed it. The other thing is that I just want to mention quickly that the USDA offers a ton of different opportunities. So I'm an epidemiologist for veterinary service that is we are in field operations. And that's part of APHIS, so the Animal Plant Health Inspection Service. But there's also FSIS. APHIS, besides veterinary services, has animal care. So there's a ton of different opportunities. We collaborate with academia. I get to work with the University of Illinois. Other of our VMOs get to interact as well to do the accreditation program. So that it's a ton of different things. I'm a member of a IMT, so an incident management team. I'm the disease reporting officer for my team. And so you also get to, if you want to go on deployment, which are much shorter than your average Army deployments, that you got opportunities for that as well. As a matter of fact, I actually just got back from the COVID response in Nevada, where Nevada is one of those states where dentists and veterinarians are also, after some training, HIPAA and some basic safety training and vaccine training, are available to can give COVID vaccinations. So that was probably one of the most impactful missions I have done, and it was really very rewarding. Not just dealing with the different agencies. There was FEMA there, Department of Health and Human Services, the local state health department, the National Guard, Army and Air National Guard. So it was just a huge interagency cooperation. And again, you got that networking going on there as well. But it was just a great time. As far as getting to the specific epi position, kind of depends on the state. For some states, it requires an advanced degree. For most of them, it does. But there are occasionally your GS11 epi positions too that don't. So obviously I'm a diplomat. I'm currently an MPH candidate, so I'm kind of doing it backwards. And again, that's MPH opens so many doors. I think the reason I started it was mostly because I felt, a little bored in quarantine after I came back from Africa, and it seemed like a good idea at the time. But I am really enjoying it, and but also ready for it to be over with. So, anyways, variety of experiences. There's all kinds of things you can do. I just think being adaptable and flexible is key. Okay, and yeah, just about me. So I love new challenges. I like to try new things. I also think that, you know, if you're a person that really just likes to be in that lane and kind of doesn't deviate from that, you make your life a lot harder. I think none of us are that great that there's or is that good at something that we don't learn something new. I learn something new every day. Today I'm dealing with my first positive Greeby case I'm tracing. So it's just, there's always new things in life. And I would say in general, I try to take myself not too seriously, and that usually seems to work out for me. And other than that, happy to answer any questions, and obviously did not proofread this slide, but anyone that wants to contact me, just my email address is right there, and that's all I have.
Thank you, Dr. Wire, and we will finish up our panelist with Dr. Morgan Mander.
Thank you, sir. Good afternoon, everyone. We've obviously got some wonderful VCOs, past and present, on the line, so it's definitely an honor to be able to represent the veterinary corps today. But if you've got questions, there's a wealth of experience out there. So I will just start with my route. I went to the University of Tennessee for vet school and did my DVM and MPH concurrently. And while I was there, I was a recipient of the Health Professions Scholarship Program. So commissioned as a captain into the United States Army Veterinary Corps. And my current role is an instructor for the first year graduate veterinary education at Fort Campbell. And so actually Dr. Rosfeld had this job prior to me and left me a really good program. So it was nice to step into her shoes. But back when I commissioned, this program didn't exist. And so it's been kind of cool to be a part of it as an instructor and a mentor, and basically coordinating a lot of training opportunities in public health, food safety, and leadership. A little less on the clinical services. I work with an emergency critical care specialist that pretty much handles that lane, but preparing our veterinary corps officers, because for me, I didn't have the program, and I went out to Minot Air Force Base kind of alone and mostly unafraid, and so then left Minot, where they say freezing's the reason, or why not Minot, freezing's the reason, and got to go to sunny Spain, where I was responsible for all the food protection missions for Spain and Portugal, and occasionally down in Africa, and then of course taking comprehensive care of the military working dogs. Also deployed to Kuwait, where I was a veterinary service support team, OIC, did public health, food safety, and working dogs there as well. That was part of the 72nd, which is one of our deployable units, and then came back and was their operations officer, where I was responsible for soldier readiness, safety, and training. And so those are jobs that are pretty representative of what the veterinary corps does. Obviously, a lot of different locations across the globe. So we can go on to the next slide, please. And so exactly who we are. I like the variety of the photos on here. I think it's really representative of who we are and the excitement that comes with being a veterinary corps officer. We pride ourselves on being agile and adaptive officers who are well-trained technical experts in the field, who can lead and foster healthy communities at home and across the globe, including in some challenging, austere locations. And so we serve all of the Department of Defense and the different branches of service, which you probably noticed from my background. I was on an Air Force base and then Navy base. So actually, when I got to Fort Campbell, I'd actually really not spent much time with the Army, despite having been in the Army about 5 years. So just a wealth of opportunities, and we can go to the next slide where we'll talk about the mission of what the veterinary corps does. So I like this diagram here because the veterinary corps really does take a One Health approach. And you can see the veterinary corps there in the center of that Venn diagram, where food protection, veterinary public health, R&D, and animal medicine are all intersecting, and the vet corps is fortunate enough to be in the center of it as we support and protect the health of the forces across the spectrum of operations, while also making sure that families back home are healthy and their pets, as well as the government-owned animals and the environment. And so to be able to conserve the fighting strength of all of those that serve our nation is just really, really a fantastic mission to be a part of. So hopefully that writing's not too small, because there are a lot of pay incentives and benefits. And I wanted to just highlight that for me, I came in through the HPSP program, which is how a lot of our veterinary corps officers are coming in these days. So a scholarship in vet school, then typically go through the FIGV program and then out to their first assignment. And so for somebody who's looking for a career change, obviously that opportunity won't exist, but there is a health professions loan repayment program. And so paying back those qualifying education loans. And there's just some figures there for active duty versus reserves. And sometimes there's accession bonuses. And so making sure that those get written into your contract when you talk with a recruiter. And right now we actually are looking for preventative medicine veterinary officers. And so as a veterinarian, you get a $5,000 a year bonus. And then if you have board certification pay, such as ACVPM, it's an additional $6,000. And then there's a retention bonus. Once you've completed your initial service obligation, you're eligible for retention bonuses. And the numbers that are listed there are specifically for veterinary preventive medicine officers, because we're in need of them. And so those numbers are actually higher than for some of the other specialties, like the clinical medicine specialties. So just wanted to point that out. And the education opportunities, not just paid CE, but also the post-DVM opportunities. So you heard Dr. Rosfeld mention doing EIS, lots of opportunities to do an MPH, or I'm considering doing a DRPH next, or a fellowship as well. So lots of great opportunities. And I would be remiss if I didn't talk about the leadership and management opportunities as well. That truly is a large part of what we do. At the end of the day, we are an officer in the United States Army, and that has to be first and foremost what we're doing as well. So just a great opportunity to lead soldiers and play an important role in their growth and development as they serve our nation as well. All right, so this is eligibility. I won't go too much into it, but just have that there, and a website, an email address that you can reach out to if you've got more recruiting type specific questions. And, if you're older than 42, there may be an age waiver available. So I had the email address that goes to a box that's monitoring questions, but this is my email address. I'm happy to answer questions at any time, and just had a few pictures to kind of capture who I am. Miss traveling on the left there in New Zealand, and the photo on the right is supposed to capture most of the things that I like. So I've got my chickens, my dog, my husband, and gardening. And I just love my smile on that middle photo. That's finishing the 12-mile ruck. It's a 35-pound pack on my back. I've just spent 2 weeks in the field for the expert field medical badge. And that was my smile crossing the finish line. So I like that photo. And I think it's important to remember that while we are at that intersection of One Health, and there's a ton of great opportunities in the vet corps, we are Army veterinarians, not just veterinarians in the Army. Happy to answer any questions, but that concludes all that I have.
Thank you, Dr. Mander, and I thank all of the panelists, a stellar group of individuals, veterinarians, professionals, very, very impressive. Hopefully you can stick around for a few questions. We do want to open it up for questions now for our attendees. If you have a question, if you can just raise your hand, or type your question in the question and answer feature. Make sure if you type your question, you ask or let me know who the question is for. Okay, I'm not seeing any questions. I will ask one more time. Does anyone have any questions of any of the panelists? Well, I will now show on the screen, you should see all of the individuals' email addresses. The first one is Dr. Greeby. So with that, Dr. Voll, did you have any closing comments?
No, I didn't. Thank you so much to our panelists. So that was fantastic. This should be available too on the ACVPM YouTube channel at some point for people that couldn't attend but might want to watch it at a later time. If you can advance one more slide though, Dr. Toring, there is an email address there. If you think of other career fields that you might want to know more about, where we do want to do more panel discussion, so you can send any suggestions to that ACVPM Partners email at the end. But I appreciate the panelists giving such a fantastic presentation, and thanks to all of you for attending today.
Thank you for attending. And as Dr. Voll said, this will be available on the ACVPM YouTube page within the next week or so. Thank you again for your attendance and have a wonderful day.